Have you ever wondered if your child's weight gain is just baby fat that will disappear, or something more serious? Or maybe you've struggled with weight since childhood and noticed it's harder to lose now? Today, we're exploring a crucial question that affects millions of families but rarely gets discussed properly. What's the difference between childhood obesity and adult obesity when it comes to exercise results? Understanding this difference could change your child's future health and help adults approach weight loss more effectively. Let's start with some eye-opening statistics. According to the World Health Organization, 390 million children and adolescents aged 5 to 19 are overweight or obese worldwide. Even more shocking, this number has increased tenfold over the past 40 years. The United States sees similar trends, with 1 in 5 children and adolescents affected by obesity. But here's the critical question. Does obesity in childhood respond to exercise the same way as adult obesity? The answer is absolutely not, and understanding why matters tremendously. The first major difference lies in fat cell characteristics. Here's something most people don't know. The number of fat cells in your body is largely determined during childhood. Groundbreaking research from Sweden's Karolinska Institute found that fat cell numbers increase rapidly during childhood and adolescence, then become relatively fixed by the early 20s. What does this mean? Obese children develop far more fat cells. Studies show obese children can have up to 3 times more fat cells than normal weight children. Adult obesity, on the other hand, mostly involves existing fat cells getting larger, not multiplying. Why does this matter? Because you can shrink fat cells through diet and exercise, but the number of fat cells is nearly impossible to reduce. This means someone obese since childhood will always have more fat cells, making them more prone to weight regain even after successful weight loss. Harvard Medical School's Childhood Obesity Research Center published a sobering 20-year longitudinal study. 80% of children who were obese remained obese as adults. Even those who achieved normal weight had 5 times higher risk of weight regain compared to people who were never obese. This isn't about willpower, it's basic physiology driven by fat cell numbers. The second critical difference is metabolic rate and exercise efficiency. Surprisingly, children and adolescents have significantly higher basal metabolic rates than adults. Basal metabolic rate is the energy your body burns at complete rest. National Institutes of Health research comparing a 10-year-old child and 40-year-old adult of the same weight found the child's metabolic rate was about 25% higher. The implication is clear. Kids burn calories much faster during the same exercise. Even more interesting is the afterburn effect. Scientists call this excess post-exercise oxygen consumption, or EPOC. Researchers at Loughborough University in the UK measured obese children and obese adults after identical exercise sessions for 24 hours. The results were striking. Children burned an average of 180 extra calories in the 24 hours post-exercise, while adults burned only 95 calories, nearly double the afterburn effect. The third difference is muscle building capacity. Exercise isn't just about burning fat. Building muscle is actually more important because greater muscle mass increases your basal metabolic rate, making you resistant to weight gain even at rest. But muscle building ability varies dramatically with age. German Sport University researchers put obese adolescents aged 12 to 16 and obese adults aged 35 to 45 through identical 12-week strength training programs. The results were clear. Adolescents increased muscle mass by an average of 12%, while adults managed only 6% gains. Teenagers built muscle twice as fast due to abundant growth hormone and testosterone during their developmental years. The fourth factor is habit formation. This isn't physiological but may be the most important for long-term success. Yale University's psychology department conducted a remarkable 10-year study. People who established regular exercise habits before age 10 had an 85% probability of continuing exercise as adults. Those who started exercising as adults had only a 30% chance of maintaining it beyond 1 year. Why such a stark difference? The developing brain forms habit circuits rapidly and flexibly, a property scientists call neuroplasticity. Exercise habits formed in childhood become deeply encoded in the basal ganglia, creating lifelong patterns. Adult brains require far more time and effort to rewire established habit circuits. The fifth difference involves psychological factors. University of Toronto's Child Development Institute found that people obese since childhood often carry weight-related trauma and low self-esteem. 68% of study participants reported being teased or bullied about their weight at school. These negative experiences create psychological barriers to exercise and weight loss that persist into adulthood. Adult-onset obesity typically results from lifestyle changes, stress, or specific life events like pregnancy. The psychological burden is generally lighter, making it easier to start exercising without deep-seated emotional resistance. Individual experiences vary, of course, but statistics show clear trends. The sixth factor is hormonal environment. Obesity disrupts hormonal balance throughout the body, particularly causing insulin resistance and leptin resistance. Copenhagen University's endocrinology research found people obese for over 10 years had 3 times higher insulin resistance compared to those obese less than 2 years. Think about the implications. Someone obese since childhood reaches their 20s with already 10+ years of obesity. Someone becoming obese at 30 has relatively shorter obesity duration. Longer obesity duration means more severe metabolic dysfunction, making weight loss through exercise significantly harder. Studies show people with longer obesity duration lost weight 40% slower on identical exercise programs. The seventh difference involves joint and skeletal systems. Obesity places enormous stress on knees, ankles, and spine. But childhood joints and bones are still growing and remarkably flexible, with superior recovery capacity. American Academy of Orthopedic Surgeons research shows obese children who lose weight and exercise regularly can restore joint health to nearly normal levels. Adult obesity, especially after 40, often comes with significant joint damage already established. One study found 72% of people in their 50s who'd been obese for over 10 years showed early signs of knee osteoarthritis. Damaged joints make exercise difficult, creating a vicious cycle. Exercise becomes painful, so weight increases, which further damages joints. The eighth factor is cardiovascular differences. Obesity affects the heart and blood vessels profoundly, but children and adolescents have cardiovascular systems not yet significantly damaged with excellent recovery potential. American Heart Association research showed obese teenagers who exercised regularly for 6 months restored blood pressure, cholesterol, and heart rate variability to nearly normal ranges. Long-term obese adults often already have atherosclerosis, hypertension, or high cholesterol. Exercise alone may not fully reverse these conditions, and medication becomes necessary. Statistics show 55% of people in their 40s who've been obese for over 10 years take blood pressure medication. The ninth difference is fat distribution patterns. Interestingly, children and adults store fat differently. Children primarily accumulate subcutaneous fat under the skin, while adults, especially middle-aged and older, rapidly accumulate visceral fat around organs. Visceral fat is far more dangerous because it secretes inflammatory substances and hormones that increase diabetes, cardiovascular disease, and cancer risk. Kyoto University Medical School research comparing obese adolescents and obese middle-aged adults with identical BMIs found middle-aged adults had 2.8 times more visceral fat on average. Fortunately, visceral fat responds better to exercise than subcutaneous fat. However, extensive visceral fat accumulation indicates elevated metabolic disease risk requiring careful management. The 10th factor is recovery capacity and immune function. Younger ages come with superior overall recovery ability. McGill University immunology researchers found obesity-damaged immune function recovers quickly in children. through exercise and weight loss. Their study showed obese children who exercised regularly for 3 months improved immune cell function by 35% on average. Long-term obese adults exist in chronic inflammatory states with slower immune recovery. Obesity-induced chronic inflammation causes various diseases and reduces exercise effectiveness. When obese adults over 40 completed identical 3-month exercise programs, immune function improved only 18%. So what does this mean in practical terms? Let me share a landmark comparative study from Paris Descartes University. Researchers put 200 obese adolescents aged 12 to 16 and 200 obese adults aged 35 to 50 through identical 6-month programs. 5 sessions weekly, 60 minutes each, combining aerobic and strength training. But if you're already an adult, don't give up. The best time to start is now. Small changes add up to big transformations. Your healthy future starts today. If this video helped you, please like and subscribe. Share it with parents worried about their children's health or friends struggling with weight management. Leave your experiences or questions in the comments. Stay healthy, everyone. Thank you.